Hi, my name is Alexis, and I'm a clinical nurse leader, formerly known as a charge nurse, in an ER here in Sierra Vista. And I'm going to walk you through a situation that I just came upon within the last couple of months. We had a patient recently who was given Keppra IV push by a nurse. During this time, the ER was packed with patients. Rooms were full, triage rooms were full. The fast track area was full of patients, even critically sick patients. The ambulances just kept coming in, and the hallway was lined with patients in beds, chairs, and we were just getting the ambulances back to back. People kept checking in through the lobby. Um, the assignments were given, and we only had mid-shifters for a couple of more hours, so we were trying to roll patients in and out as fast as we could before we lost them. We had one trauma bay finally open up, and just as we did, the EMS-COM rang, which is how EMS gets a hold of us to let us know that they're bringing in a patient. And they told us that they were bringing in a code blue, so CPR was in progress. And while the bay was being prepared and I was picking my staff to run the code, one of my staff informed me that this staff member next door gave Keppra IV push, and the patient was beginning to tremor. So what went wrong in this scenario? Overcrowding of the ER has become such a big problem. The staff isn't able to get the patients fast enough. There's longer wait times, and overall it just creates such a huge stress for the staff. When you only have 6 to 8 staff members for 40 to 50 patients in a little 22-bed ER, it creates a problem. We aren't able to get to those critical patients fast enough because there just aren't enough resources, and the staff feels responsible. The nurse who pushed this Keppra should have stayed at bedside the entire time, not only for the medication, give the medication, but to watch for a reaction, because this patient had had many med sensitivities in the past and has been having recurring seizures while in the ER. Um, and for a new medication, this nurse should have stayed at bedside. She had one other patient, but they weren't critical at that time. And the nurse should have been honest and forthcoming about her mistake. Hearing it secondhand doesn't make me happy, or any other supervisor for that matter. She should have just been honest with me, and we could have just fixed the problem from the start. So my job as a clinical nurse leader is to first of all assess the situation. I need to get the facts from the nurse who took care of this patient. I need to get the facts on how this patient is doing, and I need to see the patient for my own eyes, see how they're doing, see how they're reacting, and that's the first part of my job. The only reason I need to intervene is if there is something that needs to be done for the patient, if no intervention has been done. But usually, if no intervention is needed and just assessment needs to be done, I usually don't stay in the room and make a big scene of it, because usually when patients see a management badge of any kind, it kind of creates an unnecessary anxiety. But at this point, the patient was starting to tremor. I spoke to him. He said he was feeling okay, even though he was tremoring. He was trying to be a trooper through it. So we went and let the physician know. Another job of mine is to educate the staff, show them the policies and the evidence-based practice that we have, and you need to be professional and courteous. No one likes to be talked to as if they're a child or incompetent, but you still need to be firm with them. You can't just laugh it off. These are people's lives that we have in our hands here. How can we support each other? In the ER, or any floor for that matter, you need to keep the situation positive. Co-workers and employees are known to be negative and nasty and spread rumors about the situation that aren't true. And unfortunately, it happens, but my job is to be positive, choose my words wisely, and just put the situation in the past if it's been taken care of at that moment. There's no reason to be reliving it every day. And mistakes are how we learn. We don't need to keep making the same mistake every time. You know, one mishap doesn't define you, but reoccurring mistakes do become a problem. We need to be able to trust each other and work together. People mess up, and that's just what happens. End of story. We need to be able to work together and know that we're going to be able to take care of this patient together. And all team members should be involved, not just the nurses, but the techs, the physicians, the director, in taking care of this patient. How can we focus on the patient? The ER especially, I know that other floors are more bedside nursing, but in the ER we need to get away from the task-oriented care and actually treat the patient and stop being so skill and task-oriented and assess the actual human being that's in front of us. We don't need to be treating the monitor. We don't need to be just doing the tasks that the provider is putting into the computer for us. We need to actually take care of the patient themselves. Um, and I like to make assignments based on the strengths and weaknesses that I know that my nurses have. You need to be smart and know your team. Don't put a brand new nurse in the trauma bays and don't put an experienced nurse in a fast track area. That's not using your resources appropriately. And don't focus on mistake. Focus on doing better, doing a better job the next time and just keep on going. And how can it be done better next time? The doctors also need to be responsible when it comes to a sentinel event. They need to reread their orders. They need to be clear and concise. They can't just put in Cap or IV and expect a nurse to know, especially a new nurse, to know that it's an IV drip and not an IV push or a piggyback or anything of that nature. And orders need to be completed by the nurse in a timely manner, but they need to be efficient, not sloppy. Yes, we want to do them quickly. Yes, we want to get them done as fast as we can, but we don't want to create any mistakes. You're just taking one step forward and 10 steps back by doing that. And you also need to be honest, ask questions, be forthcoming, and express any concerns that you may have about orders or anything for that matter. Don't go forward with something that you don't feel comfortable with. When it comes to technology, it can be such a helpful tool, especially in the medical field when you're trying to do orders, you're trying to chart. It keeps it all in a very neat, organized place, unlike doing paper charting like we used to do. But again, orders need to be clarified and they can be easily rewritten in the computer. It's not like in the old days where you paper chart and you had to write a line through it and initial it. You can go back in, either delete it or cancel the order and just put in a brand new one. Technology doesn't solve everything, but it is a tool that we need to use. And the computer is only as smart as the order that you give it. It doesn't have a brain of its own. You need to be able to be confident enough to put these orders in. We also have an area for electronic protocols, procedures, and medication info that are easily accessible to nurses, techs, doctors. If there's any questions or if there needs to be any clarification before either giving an order or before performing an order. Another key technology tool that we use at work is called Quantros, which is a reporting system, and it's useful for keeping track of complaints, concerns, any event that may have happened, and it keeps it in a place where the provider can see it, the nurse who wrote it can see it, the director can see it, and it can be escalated or it can just be taken care of at that moment. How can we lessen the occurrences? Education is such a huge part of keeping nurses, techs, and doctors on their toes. There should be a constant education. It shouldn't be, well, I know it all, therefore I don't need to go to any training. That's not correct. There's new evidence-based practice coming out every year. There's new policies coming out in every facility that you work at. So education is going to be the biggest key. However, some people may do better with one-on-one remission. Some people learn better in small groups and they may feel more comfortable in that small group. So you can do one-on-one remission like I do or my director does with staff members. Another thing that we can lessen occurrences is called a root cause analysis. I'm not sure if all facilities use this, but I know ours does. And it's helpful after any sentinel event, and it's used for process improvement. It's a no finger pointing zone. You all go in, you talk out the situation, what happened, what can be improved, and I think it has a high success rate for lessening occurrences of sentinel events. Why does this keep happening? Well, in the place that I work, I notice that mistakes keep happening because there are no consequences for those nurses, for those techs, for whoever it is that keeps making those mistakes. It just keeps slipping through the cracks. And in my ER, we are so short-staffed that anybody who is there is just a warm body. It doesn't matter if these mistakes keep occurring. We just need those bodies there to take care of those patients, which is kind of counterproductive if you have someone who's going to keep making these mistakes. It's just going to make everything harder for everybody else. Um, in our facility, we have mandatory education, and I know that some of our directors and managers have let some people slip by with this, but they need to be going to their mandatory education. And the lack of management or presence of management has also been a problem. Um, if they're not there when you need them, if they're not available, always out of town, it's hard to follow through on those complaints and concerns with management if they're not present. So performance patterns. If you have a staff member that keeps making these mistakes, who continues to be a problem, there needs to be some kind of consequence if there's not going to be any improvement. In this case, this staff member needed improvement. From day one, since they got there, this particular staff member did not meet the education requirements and had an I know everything there is to know attitude. Didn't want any help with her orientation, and from day one on the floor, she was so flustered because she didn't ask for help. She didn't ask the right questions when she was being oriented, and no consequences were given by management for this reoccurring issue, which made it frustrating for everybody. So all in all, what would I do? Um, I know that I did what was right as a clinical nurse leader in taking care of the issue at that moment, taking care of the patient, talking to that nurse, reassuring the provider and the other nurses that we could all trust one another to take care of these patients in the ER. But if I was the director, I would push for those educational opportunities, and I would have taken that staff member one-on-one and had a real talk with them about their reoccurring issues. But I think staff meetings, debriefings, areas where you can have open conversations with your staff members about any complaints or concerns is a huge thing. You can take that back and really get to the root of the problem in the ER. And I also think you should have an open door policy. You should have an open mind and consider everyone's feelings and opinions and not just your own or your clique or your best friend that's on the floor. You need to consider everybody's feelings. And most of all, you need to just stand firm in being a leader. It's a very lonely road. Not everyone's going to support you. Not everybody is going to agree with what you do. And I included a quote that I believe sums up leadership. May your trails be crooked, winding, and lonesome, dangerous, leading to the most amazing view. May your mountains rise into and above the clouds, by Edward Abbey. So make sure you stand firm in being a leader and just keep pushing forward. You need to educate yourself before you can educate others and push them to be the best that they can be.